Hello and welcome to another episode of the Many Faces of Cancer podcast. I am your host, Melissa Grosboll, and joining me today is Carmen Monge. Carmen is a cancer survivor, researcher, and patient advocate working at the intersection of lived experience, research, and equity in cancer care. Originally from Costa Rica and now based in the Netherlands, her work focuses on amplifying the voices of cancer survivors across different healthcare systems. She is the founder of MANO Beyond Cancer, a global initiative exploring survivorship through qualitative research, where she has conducted nearly 100 interviews with cancer survivors from more than 60 countries. Carmen also works as a researcher and patient advocate with Youth Cancer Europe, contributing to projects on equity, diversion, and inclusion in cancer care and patient involvement in research. She is also the creator of Can, a children's book series designed to help explain the cancer journey from diagnosis to life after treatment in a holistic and accessible way. Through her work, she aims to translate patient experiences into insights that can inform more inclusive research, policy, and survivorship support worldwide. So welcome to the show, Carmen.
Thank you, Melissa.
I'm so glad to have you on. We had such a great conversation last week, and we are podcast buddies. And so I can't wait to dive into all the things that you are doing. So tell me, first of all, so you're born in Costa Rica, but you now live in the Netherlands. Like what took you to the Netherlands?
Yes, well, actually, it's a very interesting story, and it's about how I start doing everything that I do. Because after living in Costa Rica for all my childhood and getting treatment in Costa Rica, I was diagnosed in Costa Rica. I got the treatment there, and I was cured in Costa Rica. I moved away, and until now, I have lived in 8 different countries around the world.
Wow, that's fantastic.
So, yes, I was born, raised, and I got treated in Costa Rica when I was 24 years old. And after that, I decided to move abroad, like with my partner. So I have lived in many countries around the world. The first one was Australia, where I faced my first post cancer care in a high income country that I never had before, because Costa Rica, regarding healthcare system, is still middle income country in a way.
Gotcha.
So I was very surprised to see like how cancer is treated in other countries, but also how is cancer perceived in the society. Because you know that when you talk about middle and lower income countries, normally you see cancer differently from high income countries, in a way that still there is a lot of stigma and people don't talk about it because they are very afraid of it. So after living in Australia, I have lived in 4 different countries in Europe and 3 different countries in Latin America.
Wow.
So yeah, so that gave
And
me like a lot of experience as a patient survivor and as a patient advocate as well.
oh, absolutely. And just as a little thing, I don't know if you are interested in Formula One auto racing at all. I know that Max Verstappen, who's a big Formula One driver, is from the Netherlands. And I don't know if you watch Formula One racing at all or not.
No.
Okay.
But that's very
Never
interesting.
mind. I just had to put that plug in, but not everybody watches it, so never mind.
Yeah, my brother-in-law, he's really into that stuff. So actually he came to see one race that is in France that is about 3 days, like all the cars going around for 3 days or something like that.
Yeah.
So he's really into that, but I'm not.
Okay. All right. That's okay. All right, Carmen. So take us back. You talked a little bit, and I really want to dive into a lot about cancer treatment and things in different countries because you've had firsthand experience with that, or at least survivorship. But let's start off with your own cancer diagnosis. So you said that you were young when you were diagnosed. So take us through a little bit of how you were diagnosed and, what kind of was going through your mind at that time.
Well, something funny about my story is that I got diagnosed 1 month after I got engaged with my husband.
Oh my goodness. Wow.
Yeah, so we were just telling everyone that we were going to get married and everything. And yes, I felt a bump on my neck. And but I thought that was nothing serious, right? Like I used to call it my lucky coin because I was playing with that all day long. Like I was not even thinking about it. That I was 24. I was just start to having a real job after university. So and I was feeling okay. Like I had Hodgkin lymphoma and I was asymptomatic, so I didn't have any strong symptoms. Just just my lucky ball, right? So I told my one of my sisters, she's a doctor, like, hey, I have this ball, but I don't think that is nothing serious. And my sister was like, if in 2 weeks you still have it, let me know, right? And I was like, okay, because she didn't live with me; she lived in another province. So 2 weeks later, I told her like, hey, guess what? I still have it, and actually, it's a little bit bigger, right? So my
Oh,
sister
that's
was
not a
like,
good thing.
no. Well, and my sister was like, no, come to the hospital. We're going to do some checkups to see like what is it, right? So yeah, they were going to do a biopsy, and yeah, they did the biopsy, and they realized that was a tumor, that it was a lymphoma. And when they did the CT scan, they realized that actually this one was my third ball. I had two more behind my chest, and those tumors were even bigger. So in a way, it was my lucky coin because thanks to that one, I realized that I had the other two ones, right?
So you're
And
lucky and not so lucky at the same time.
yeah, exactly. Like imagine if I wouldn't discover that one, right?
Well, and
So
now if your sister hadn't said that, would you have, thought it was really anything and even gone to the doctor? Or was it all because of her that you finally went?
yeah, no, was because of her. Well, actually, first I went to see my the doctor from the company that I was working in, and yeah, he told me like, no, probably it's that you had a virus infection and you got one of your limbs inflamed, right? And that
Okay.
was it. Like he didn't put too much attention on it. But yeah, I asked my sister, and she's not an oncologist, she's not a hematologist, she has another specialty. But she was like, no, maybe you should check that out, right? Like, and I didn't have any symptoms. Like, the symptoms that you get for that one, actually, they're kind of misleading because one of them is sweating during the night. Like, I live in Costa Rica. Like, that is
You sweat all the time.
and it was April, that is super hot. Like definitely if I was sweating, I was like, okay, this is super normal, right? The other
Right.
thing is that you start losing weight, and all my life I have been skinny, so weight was not something that I was always taking care of. I never measure myself. So even if I was losing weight, I didn't notice at all. And the other thing is that when you drink alcohol, you have some kind of pain on your limbs actually, and that
Oh,
happened to me. But I didn't think that was something so bad, right? Like I just thought like probably, I don't know, I did some exercise and yeah.
right. You weren't thinking cancer because you were sore after drinking.
Yeah, thankfully after the treatment, I could drink alcohol and I don't feel any pain anymore. So in a way, it was good.
Right, that's a good thing.
Yeah, you're
And now
right.
can Hodgkin's is one of the cancers that is curable, correct? So are we cancer free today or
Yeah, well, let's. I don't know if you do this, but in Latin America, when we say like, hopefully I will not get it again. We say like, I touch wood, we like knock the wood.
oh, knock on wood, we
Yeah,
say
so
here. Yeah.
to not get it again. But yeah, for now, I have been 13 years cancer free. So
Congratulations. That's
thank
quite an
you.
accomplishment.
You know that it's something nice to say to younger people that they are doing the treatment, because like to see someone that have survived for so many years, it gives them hope, right? And that yeah, you are in a different condition that you were when you were doing the treatment. Is kind of, it is very hopeful for them.
Absolutely. Absolutely. And hope is cannot be discounted in any way because it really gets a lot of us through all the crap that we have to go through from treatment.
Exactly.
All right, so your did you always want to be a researcher? Was that kind of your university experience, or was this something that your cancer kind of helped to shape?
No, actually, for me was something very interesting because my background is chemistry. I study
Okay.
pure chemistry in the lab. Like, I like innovation, so I was doing a lot of cosmetics and food science. Like, then I graduated on food science, so everything about nutrition and everything that was my field.
Okay.
uh, and after my treatment, I kept working on that and kept studying on that field. But I focus a little bit my stories from nutrition to consumer behavior. And
Mm,
in that, you have to do a lot of literature review and to see tendencies and prevalences and things like that, right? So when I was already living in Europe, I met this NGO that is the one that I work in, and I realized that many of my skills as a researcher on consumer behavior, nutrition, and everything, I can use them in this role about research on cancer, especially on young populations and EDI, because basically is reading, is reading a lot of literature review, is see tendencies, is analyze data. So I kind of move to different field, but I still use many of the skills that I used before.
well, I would imagine they're translatable across any industry, certain ones, correct? The
Yes, yes,
skills.
yeah. It's like a basic science is very useful because you get all the data analysis, and you have this curiosity about putting numbers on everything, basically.
Absolutely. And I would imagine because you were an AYA survivor that you really wanted to kind of put your focus in that area as far as your research.
Yes, exactly. Because, well, here in Europe, and I know that in the US and Canada, and also Australia, AYA research is very strong. And actually, there are a lot of support groups and everything. But in low middle income countries, there is not a strong focus on them, on this population, actually. So something that motivated me to work on this field is because I believe in sharing knowledge everywhere in the world. So I was thinking like, if I can learn about what is been doing in Europe about this field, maybe I can bring it to Latin America and we can use it there, right? Or many things that maybe we can share between countries, because I'm not saying that everything in high income countries is better, because sometimes going back to basics to some practices in low middle income countries actually are a good idea. One example is, for me, is about loneliness. that in high income countries, you have a lot of loneliness during the treatment, but in low middle income countries you don't have that. Basically, there is people all the time helping you, and since we don't have the resources to have individual rooms for the treatments, or we don't have the resources to give personalized treatment to every patient, uh, we socialize a lot in the hospital or in the treatments, and sometimes that is actually good for the patient compared to high income countries. So I believe that sharing is caring, and in this case, to bring the useful thing that's happening in high income countries, bring it to low and middle income countries, but also the other way around.
I love that. And so, could you kind of mention that after you were finished with your treatment in Costa Rica, then you moved to Australia? Can you share with us a little bit, kind of the culture shock, the culture change, going through survivorship in a high income country versus what your treatment was like in Costa Rica?
Yes, of course. And I want to mention that one of the reasons why I agreed to move abroad, because many of the people were telling me like, no, like you are moving abroad just 1 month after you finish the treatment. That was too soon, right?
That is pretty
Uh,
quick.
yeah, I was just crazy. Like, but the thing that I thought, and also that my sister told me, was like, oh, but Australia is a high income country. It's going to be easy for you to follow up your treatment, right? And actually, that was not the case, because normally countries, they take care about the people that is already resident, and maybe that they did the treatment there. But if you did a treatment somewhere else and you arrive to a country as a survivor, basically you don't have support from the healthcare system.
Really?
So yeah, it's like in a way it's basic support, but you don't enter to all the accessibility or all the support or tools that they give to nationals and residents, right? So one thing that happened to me is that in Costa Rica, I got the portacat, like the catheter, yes,
The
yeah, the
port?
portacat. But in Costa Rica, you have to keep it for 5 years after you finish the treatment, and they do
Wow.
that. Yeah, they do that because it is very expensive to put it. So they want to make sure that actually you get to full remission before removing it. Yeah, because just to be sure, and they don't have to put it again and do the extra cost of the surgery and everything, right? So if you don't know like that, you have to clean it every 2 months. So you have
Mhm.
to put an anticoagulant, and if you don't get it clean, you can have a stroke basically, because that goes to all your heart and is everything connected. So you have to clean it every 2 months. So when I got to Australia, when I arrived, I went to the doctor and I asked him like, "Hey, can I need to clean this every 2 months? Can you do it?" And they told me like, "No, no, like we cannot clean it or we cannot remove it because you were not treated here." So I spent
Wow.
4 months without cleaning it, and I was thinking every day like, oh my god, I'm going to get a stroke. Like, what should I do? Should I go back to Costa Rica, or what should I do? Like, I didn't know. So it was a lot of anxiety, and the system, they couldn't help me because in a way they cannot remove it because they didn't put it right, and they
Right.
cannot clean it because for them they don't have like a protocol for this case. They just remove it the moment that you finish the treatment. They not keep cleaning it for 5 years.
Wow.
So it was
So
it was
were you able to eventually get it cleaned, or did you eventually get it removed?
no, I got it clean. Like there was a
Okay.
I have to mention that there was an international doctor that he helped me, because he told me, I know the struggle of being a migrant and not getting the support that you need. And I remember that so clearly because I thought like, okay, I'm so lucky to find this guy, but it's also very difficult for migrants. And that was my first thought about being a migrant and being a cancer survivor or cancer patient, how difficult can be, right? Because it's still a lot
Absolutely.
of language barrier. There is still a lot of, I don't know how the system works. So that is something that, yeah, basically from there I start my patient advocacy journey in a way, just realizing like how different system works, right?
Right. Wow. It's something that, I mean, unless you've gone through it, you don't really even understand that that's a thing. You just think, hey, cancer care is cancer care, and it's not the same globally, which, I never would have even thought about. Or maybe just don't move to another country a month after you finish treatment too.
Yeah, exactly. Yeah, yeah, but that is very common in young population, right? Like
Absolutely.
normally young people wants to move, want to live in another places. So that is a struggle that mainly AYAs have to have the support wherever they want or to follow their dreams.
Right. Yes, us older people, we tend to stay put a little bit more than younger people do. So again, it's another thing that if you're not part of that population or in that world, you just don't really even think about. Right. So this was the beginning of your really advocacy journey. And is that how you became part of Youth Cancer Europe?
No, actually that was years later.
Oh, okay.
And it was when I moved to Australia to it was when I moved to Europe.
Okay.
Because as any AYA at the beginning, I didn't want to say aloud that I had cancer because it's not common at all in young people. Like I didn't want to deal with the cancer phase. That is how I call it. When you say to someone that you had cancer and they look at you with
Right.
a face, and in normal, like in young people, it's not normal to have cancer, and you don't want to feel the victim, right?
Yep.
So for many years, I kept it to myself. Even my mental health was very bad because I was very scared about having cancer again or things like that.
Mm.
But I couldn't say it aloud because I knew that my peers wouldn't understand me because it's getting cancer at your 20s, right? It's not normal at all.
Especially if you
So
don't have a support group of other young people that are going through a similar thing, you can feel very left out.
exactly, exactly. So in Australia, like there is support, but I couldn't receive it because I was not a national or I don't know. At that moment, I didn't want to deal with that. I didn't want to deal with the cancer scenario or anything because I want to live my life. Like I didn't want to be the cancer person or the cancer chick,
Yeah,
right?
the cancer chick. I like that.
Yeah. So it was when I moved to Europe, when I was living in Ireland, in Dublin, that I start having panic attacks and a huge episode of depression, basically because I was afraid that my cancer was back. So
Mm.
that was 3 years after I finished the treatment. And apparently, it's very normal. That is the age when you are so afraid to having cancer again, 3 years or 5 years. And at that moment, I was a student. So I received support from the university in a psychological way. And they
Nice.
direct me to this support group that they have that is called ARC. So I just started going to these meetings and I realized like, hey, there is more people like me. Well, that is amazing that talk about having cancer because back in Costa Rica, I didn't have a support group. Even if I went to the hospital, like you talk with the other patients and everything, but you don't give your phone to them or anything. It's just like in hospital that you connect with them, but when you leave your home or anything, you don't have it. Well, I didn't have it at that moment. So was in Dublin when I started meeting other cancer patients and cancer survivors. And then I was curious, like in every country that I was living, I started looking for support groups, right? And to talk with people about the side effects that you have after cancer that nobody told me. So something that happened to me is that I started having these panic attacks because I was tired all the time. And even like when I was studying, I could see my peers, like my classmates, they have a lot of energy and I didn't, and I couldn't study, and my brain was not working very well. So I was thinking, like, what is happening to me? Like, I'm not, I cannot keep my studies. So I was so afraid to having cancer again that, yeah, I went down the hill in that sense. And yeah, after that I started going to support groups, and one of these support groups recommend to go to this American program, actually, that is called A Fresh Chapter. I don't know if you know about it. Like, it
I
is
don't
very
know.
nice. Yeah, Fresh
Okay.
Chapter, they focus on cancer survivorship. So it is
Okay.
normally a free online course where you go, you have a cycle, like you have like a support group, and you talk with them every week, and they start talking about different topics, or about uncertainty, or about many things after the treatments. And they uh, tell you, well, one of the assignments is to do a voluntary work.
Okay.
And that is how I started Mano, because I realized that in Latin America, especially, people don't talk about it enough. So even for my parents, until today, they cannot say that I had cancer.
Really?
Yeah, they said like, oh, when you were sick, or when this happened to your
Mm,
other stuff, but they cannot say the word cancer. And it's
gotcha.
just that it is very triggering for them, right? Or they are so afraid of the word, everything. So
I mean,
that is an
honestly, I
example.
can't really like I can't imagine what I would do if my daughter was diagnosed with cancer. I mean, it's a whole different thing when it's your child versus somebody else out in the world.
Yeah, yeah, you can see it, like for them it's completely different
Right.
from what.
And I mean, I'm in the cancer world, so I would be able to talk about it, but just still the emotions there. And if you're not used to talking about it, I mean, that just had to be devastating for them.
Yeah, no, and even years after that happened, I talked with my parents, and they said all the time, like, we were so worried about it, and you couldn't see it, but actually my mom was crying a lot in the room next to me, and I didn't realize it, right? Like, there are so
Well, we
many
don't want to
things.
share that with our kids. We need to be strong for our
Exactly.
kids. Yeah. And then
Exactly.
break
So
down in private. Yeah.
I admire that so much about parents, because they could really feel how your kid is feeling in a way, right? They have a lot of empathy
Mhm.
about it.
Right.
So okay, so I
You
just
started
started
mono.
yeah, I started Mano, and the intention was to interview cancer survivors from Latin America. So I started interviewing from every country in Latin America, and after 2 years, I finished the whole continent, and I was like, "What else?" Right? So I started then interviewing cancer survivors from around the world, and that is how I started. And then I started working with Youth Cancer Europe, because I was really into this topic already. I knew
Mhm.
so many testimonies and so many experiences that I want to do something more about it. And it was just working on this.
So in all of your almost 100 interviews from people all over the world, can you give us, I know there are many, but can you give us kind of one thing that is pretty much the same for all cancer survivors around the world and then maybe one thing that you noticed that was vastly different depending on where people are in the world, as far as cancer treatments, diagnosis, mental health, like anything.
Yes. Well, something that I realized is that cancer survivors or cancer patients normally like to hang out with other cancer patients and cancer survivors. Like, doesn't matter where you are, you feel like part of this community, that all of you had a similar experience, and we all have the same, maybe the same feelings at that moment. So that kind of bring us together, like in a very nice way. Many of my best friends are cancer survivors as well, and it's this connection that you make with them. And in a way, you feel lucky to meet them, not because they had cancer, obviously, but you feel lucky to meet them and to talk with them and everything, because there is nobody that is going to understand you better than another cancer survivor. And it's something that not too many
Absolutely.
people can relate. Even my parents, that they were my parents, like probably parents that had children with cancer can relate to other parents, but they cannot relate to the patient itself, right? So that is something that we
Absolutely.
all have in common. Like, we like to hang out with each other.
I say
And
it's like the worst club with the
yeah,
best members.
yeah, exactly. That is what the friend says to me. Like, it's amazing how, like, after these horrible things happen to you, you meet the best people. So
Absolutely.
it's amazing. And something that is very different, I will say, that is still the stigma and the accessibility, like the access to resources. Like, how do you see cancer? Like, for me, it's heartbreaking to see that in high income countries, the survival rate of childhood cancer is 80%, but in low income countries is only 30%. So that in
Wow. That's a
yeah,
huge
it is
difference.
very like, is basically that where you were born or where you live decides if you are going to live, right?
Mm.
So
Wow.
for me, that is
Right.
heartbreaking. And when you talk with people from high income countries, definitely what they are focused more is very different to the people from low middle income countries. Why? Because, like, in high income countries, are already thinking about mental health. You are already thinking about what is happening after the treatment, like many important things. But you can only think about that when you have a good survival rate and when people survives. And when you talk with low middle income countries patients and survivors, they are mostly more concerned about survive itself,
Right.
accessibility, about a lot of things. And after treatment, there is not a lot of care, actually, because normally people have to keep working, right? Like,
Yeah.
in low middle income countries, like, you have to go back to normal, but it is more like a responsibility because you have to support your family, or you have to keep going. Like, you cannot stop and think like, hey, I'm not feeling well mentally, or I'm not feeling well emotionally. Like, we in low middle income countries, we don't have that privilege in a way.
Luxury.
Yeah, luxury.
Yeah.
But I like the word
Yeah.
privilege.
Yeah. Wow. Again, thank you so much for sharing all of this because, those of us who are in the high income countries, we don't necessarily think about that. We think about, okay, how do we take care of ourselves once we're done? We don't always think about, am I ever going to be done? And then I got to go back to work. I don't have the luxury of being able to be sick.
Yes, and something is about the resources, right? Because you have that, but also you have fertility preservation. And that is something very important for the cancer survivor and for the AYAs and childhood cancer survivors.
Absolutely.
because
Mhm.
that was one of the first thing that my doctor told me when I got diagnosed. Probably you are not going to be able to have kids, and it's something that you have to face, and that if you don't have the money is your future, right? Like you cannot say anything about it because you're in a country that having those kind of treatments, they're super expensive and the healthcare system doesn't cover it. So in high income countries, you have it since the moment that you got diagnosed, right? You get diagnosed and the next day you are going to the fertility clinic.
Yeah.
But in other
Hopefully.
countries, you don't have it. So it's completely different, the future, from a person from a low middle income country and from a high income country.
Now, is that kind of how you got started in working in EDI and doing that kind of advocacy work?
Yes, mostly because I was one of the underrepresented and underserved group that was to be a migrant in a country where I didn't feel a real support from the local organizations, right? So I was intrigued about that. But when I keep working with YC, with Youth Cancer Europe about this topic, I realize about many other underserved and underrepresented communities that are also affected by the system. And this is the LGBT community, the people from low education, low resources, also the neurodivergent population that is a topic that for me is very important because
Okay.
I grew up with a cousin that he was neurodivergent, and his dad died from cancer, and it was very
Hmm.
difficult for him to I don't know, to
Process.
digest everything that was happening because he was part of this group, that there is not enough research regarding this and cancer. And I start reading about it, like what is happening to my cousin if he get diagnosed as well with cancer, right? Because the
Mm.
genetic is what the genetic type, and you realize that there is not enough research about this population, and 7 in every 10 people, they are part of the neurodivergent community, but many of them doesn't know it. So you think like almost
Wow, I
everyone
didn't
is
realize it was that high.
neurodivergent. Yeah.
That's
Yeah,
insane.
it's insane. Yeah, and we don't have enough research about that, and we don't have enough research about so many populations that they still get cancer, right? Like people without a home, or many type of disabilities, or so many things that cancer treatments are made just for white population from high income countries, but all the rest clinical trials, all the rest population, they are not in the clinical trials. So clinical trials, they are not representative in a global way.
Gotcha. Wow. So we need like thousands more of you doing all of this research around the world so we can change all of that, right?
Yeah, yeah. We need an holistic change, not only patient advocates, but researchers, healthcare providers, every person that wants to know more about EDI in cancer care and research.
Absolutely. Absolutely. Wow. I I am being taught so much today. So I so appreciate all of this because it's something that I don't normally think about. So thank you again. I think I've thanked you before, but thank you again. All right. In the few minutes we have left, I want you to share a little bit about Can. Tell us how that was created and and how we can and what it's all about and then how we can get access to it.
Nice. So Cancan, I brought it because you told me, and I was like, "Oh, I have to bring it." So Cancan and the Adventure of the Ming Island. Well, this is the first book. The idea is that there are going to be three books, and I'm going to tell you the reasoning behind that. But the idea is that after so many interviews, I realized that people still don't talk about cancer, and there are still many topics about cancer that people don't talk at all. So when you hear cancer, you think about the bald person in a hospital room and the physical effects that cancer can bring you, right? But nobody
Hmm.
talks about how it's going to affect your social life, how it's going to affect your emotions. So I really want to talk about this. And I really want to talk about not only the diagnosis, but also how all these challenges affect when you finish the treatment and the life after cancer. So I base the book on research. Actually, many of the ideas that I get is because I have seen a tendency in research about this topic, about these fears, about everything. And the idea to do three books was thanks to a research from Natalie Belpalme. She is a researcher from Ghent University Hospital, Medical University, well, in Belgium. And she talks
Okay.
about that cancer in young people is divided in three stages. The first one is the diagnosis, when you get diagnosed, and actually you don't want to talk with other people that had cancer because you think like, okay, I'm going to finish the treatment and everything is going to be normal again, right? Like there is this, like this desire uh, to that your life stays the same. Like how do you say,
Hmm.
like there is this desire of preserving your current life, and
Right.
then uh, when you are going through the treatment you realize like, okay, nothing is going to be normal anymore, and you start talking with people that had cancer and having other type of friends and things like that, right? And then we have life after cancer. That is the topic that I want to talk more about, because that is actually, that was the most difficult part for me, was after I finished the treatment, because I had my mental health breakout. Like I was in depression and panic attacks and everything. And I wanted to talk about that as well, and about chemo brain and chronic fatigue that I also had. So that is the idea. The books are aimed to be read by children from 7 to 11 years old.
Okay.
um, Cancan is the panda, and his name is Cancan because if I can do it once I can do it twice. And his best friend is Mopri. Is a slot, obviously because I'm from Costa Rica, and I needed to include a slot. And yeah,
Of
there
course.
are other friends. So I'm all about EDI, right? So something that I wanted to do is that the caregiver is a monkey, because I really believe in diverse families. So it's someone that is from a different race than Cancan, because there is all kind of families and caregivers. Doesn't have to be your direct family or biological family. So we have the doctor, that is Dr. Oli, and we have the toucan that is called Mao. And the joke about Mao is that he says like, if I can, you too can. So I love
Oh, that's
I
perfect.
love to play with words, right? So the
That's
first book,
fantastic.
it is in Spanish and in English. Obviously, I wrote it in English because it was published in the Netherlands. And
Okay.
every chapter has 8 chapters. Every chapter discuss something about a challenge in cancer. So one is a physical challenge, the other one is a social challenge, and the other one is an emotional challenge. So in
I
here,
love
I
that.
explain what is cancer and things like that, and it's very interactive because let me show you this one. Because actually it has a map, so uh, every point on the map is a chapter. So and
Oh,
Cancan is going to he's looking for the golden crab. That is the treasure that he has to find to basically to deal with his cancer journey.
oh, I love that. And it is available on Amazon, and we will put a link to it in the show notes along with all of your other contact information.
Mhm.
Um, so thank you so much, Carmen, for this today. You have taught us a lot. You've helped us really think differently about things, and I really appreciate you taking the time to share all of this with us. And I'm just so grateful for this conversation today.
Me too. Me too. Thank you for contacting me. Thank you to Renee as well because she told me about you.
Yes. All right. Well, I really appreciate your time today and have a wonderful rest of your day.
You too. Thank you. Thank you, Melissa. And have a
All
good
right. Bye
one.
bye.
Bye bye.